Today, Nexus connects us to Stan Jones. Stan is the inventor of optimal air, and he oversees the sleep training and the dental appliance training here at Nexus Dental Systems. I've worked hand in hand with Stan and my dentist in order to get fitted for a device that I'm going to be fitted with this week. So I'm excited about that. Stan also was just recently featured. I wanted to show this off. He was just recently featured in the Dental Sleep Practice magazine. So you may be familiar with him if you subscribe to Dental Sleep Practice. There's a whole article in here about Stan and about the work that Stan has been doing in making your life better through the science of sleep. And it is really interesting. I got a chance to use the Optimum Air product in the lab, in the clinic with Stan, where he was fitting me and using the device. And it was really interesting. Interestingly enough, I actually had gone to a different dentist to be fitted for a sleep apnea device, and their measurements were totally different than Stan's were. I trust Stan's a little more. So I would invite you to encourage you, if you're in the dental industry, make sure you pick up a copy of Dental Sleep Practice. And if you don't have a copy, listen in, because here we go. Today, Nexus connects us to Stan. Welcome back to another edition of Nexus Connects Us. Today, Nexus connects us to Stan Jones. Stan, welcome. I know you've been here before, but it's good to see you again. I'm excited to have you because I was so impressed when you were here. What was it, 2-3 weeks ago? And you worked with me on getting fitted for my device. And I really was impressed by the whole process. And we started talking about more of what separates Nexus from other organizations. And I felt like I went back and pitched to the leadership, and I'm like, we got to have Stan on a show. So welcome, Stan. It's good to have you here from North Carolina.
Good to be back. Always willing to talk about dental sleep medicine and how we're empowering people and changing people's lives.
Yeah. And from my experience, it was really interesting because we went to a neutral place, right? Because we didn't have a dentist in my area. So I called my dentist, who's very progressive. Thank you, Dr. Drew, for allowing us to come into your facility. And, it was interesting because you can tell you've been there before in many dental clinics, because you were calling out items by their technical names, and they were like, whoa, okay, wait, this guy knows what he's doing. And I think that's part of what really makes us different, right? It's not that Nexus is just there to try to sell our solution. It's really about making the dental professional a success in this and helping the end patient. Let's talk a little bit about that. I mean, I know that there's the optimal air part of what you do, which you were the inventor of, but let's talk about what separates Nexus from the other solutions that are out there in the market.
Yeah. I mean, without giving away the secret sauce, so to speak, I think the biggest thing is anybody can look at me and tell I'm not a young chicken, but when I was a younger man, customer service meant something. Yeah. I mean, you actually stood by your product and you tried to form a relationship with your clients. I think we got away from that as a country as a whole, but especially in dentistry. And when I walk into offices and we talk to dentists and tell them, hey, we're going to come by in here. We don't want to just sell you something and then say, hey, here it is. Good luck. See you later. We want to actually walk with you in this journey of implementation, education, implementation, coaching, training, mentoring, and support. Well, and there's just so much more I don't have time to talk about that we do for our customers. But I think the fact that we come in and we can connect with them, we understand dentistry, and they're making a transition and they're adding something new to their dental practice. This is not our first rodeo. We've been doing this for a while. I've been around doing this for over 27 years, and with just dental sleep medicine alone, probably 33 years as a dental assistant and a lab tech myself, So they soon realized that I know what I'm talking about, and that we understand their job and what they deal with on a normal basis. So that allows them to open up to us and to be able to come in and connect with them. And when you connect with people, they're more open to training. And again, I like to gravitate away from the word training and teaching to more like empowerment. I think we empower our dentists and their teams to learn a new skill, a new area of specialized dentistry that they can totally change people's lives.
Yeah. And I have to say, I work with a lot of experts in a lot of different fields. And one of the things that experts do, and I'm one in operations, is we tend to go in and just tell people how it should be. But what I loved about your mannerism when you were there was you first asked, well, okay, what do you know? Right? What systems have you learned in the past? And then you said, well, okay, so since you've learned that in the past, here's what you've been told and here's what you've been taught. And they're going, yeah, that's right. That's exactly. Now, let me explain to you why those things are somewhat true, but also are somewhat false. And you sort of walk that through. And a person goes, yeah, I could totally see that, right? Because you establish that not only are you, there to your point, sort of educate them, but it's also you understand where they've been in their journey and you're able to say, okay, I get it. Because at one point, yeah, I believe that too. But here's what's been found over and over and over time and time again through the use of these devices and the application of these devices in the field. And I think that's what really gives you that expertise and that gravitas to sit down with a team and really make yourself part of that team and make you a trusted advisor to them in this process. Let's talk a little bit about the actual process itself, because on this show, we've talked about why you should get tested. We've even talked about having a sleep study and why that's so important. Now, I've had a dental snore guard in the past. We're going to put that in quotes because that's the way that many dentists pitch these snore guards is, hey, this isn't, they don't say the word sleep apnea if they're smart. They say, oh, this will help reduce snoring. But your process is very different. In that past process, literally they did a mold. They shoot the goo in your mouth, right? They get everything formed. They peel all that off. They send it off to a lab and they have this device that's got a couple screws on it and they put it in there and they tighten up the screws and they say, well, that's set in your jaw. That should work. Give it a try and let us know, right? That's a completely different experience to what I experienced.
That's right.
It was way different. I was like, now listen, I think we've been recording this show for 4 months. And right at the beginning, I said, let's do this. And they're like, it's going to take a little bit of time. You got to do a sleep study. We got to get you with a cardiologist. We got to talk through your results. We have to get things scheduled. We've got to get the proper measurement and even the measurement piece. And I have to admit, remember, I went to another dentist at first to try to do this. And he's like, oh, molds will work. And you were like, molds will not work in any way, shape, or form.
Well, we do have a lot of dentists that have not come up to the digital age. They're not doing digital scanning, and we're not going to say anything bad about them or anything. I mean, a set of impressions, a real good set of impressions taken by a skilled individual can produce a decent appliance. But I'll be honest with you, everything's gone digital, and we can make a reverse reproduction of a true image. And when that comes over, it gives the lab technician something that they can work with to create. So I've always said this: the quality of what we send to a lab is the quality of what we get back. Mm-hmm. And we were able to get and we were very blessed that day to have a great dental assistant that we were able to work with in this office with me and you and the dentist. And she did a great job scanning, all of your dentition, your teeth, your oral cavity. And she did a great, and I know I looked at it, we talked to her about it. Beautiful, and because she got a great scan and we were able to send that over with the proper therapeutic bite set vertically and horizontally, we're just believing you're going to get a great appliance and you have great results.
I'm sure we will. And I'm sure right now we're going to be showing that video because we do have a video of the scan of my mouth. And I think it was so interesting because I guess I thought it would be like an x-ray. It was three-dimensional. It was all the coloration was right. I could see, striations in my teeth. I mean, it was incredibly high definition imagery. So talk a little bit about that. They're using is it an optical scanner? How does that, what type of device is that? And I know they're using a scanner that's off the market. Is that what is it optical? Is that how they're capturing that? Do you know?
Yeah, kind of, without getting into deep to
The
it.
technical, yeah.
Yeah, it's basically what you're saying. But on one thing, there's a lot of different companies out there that make these scanners, and I'd say there's several, maybe 3 or 4, 5 of them that are what we call in the top level scanners that they really produce a great reverse image or a mirror image of your teeth and or any tissue in the oral cavity. And they've come just leaps and bounds with what I remember when we had no scanners. And then we saw the early scanners, and then they kept getting better and better. I remember when we used to have to spray, you had to spray like a powder on your teeth because nothing that was shiny or nothing that would reflect from light. It had to be like a dull. And then we had to like make sure all the lights were turned down in the operatory because we didn't want any reflective light. So now they've gotten so much better. The technology has gotten so much better that a clinician can learn. And, I was talking with the one that was there, and she was very well trained. And she was able very quickly to scan your lower arch, your mandibular, and your maxilla, your upper arch. And then we put your bite in relationship. She just did a great job. And I wish we could say what kind of scanner that was, but we don't want to get into that. We got to be careful, But
we're gonna blur out the logo on the screen. But
it was one of the top. It's in the top 3. It's in the top 3 of scanners. I'll put it to you that way. And we enjoy working with that company, and that's no doubt about it. But that scan was great because you remember once we did it, we could actually take our finger, touch the screen, and we could move it, and we could turn your whole bite sideways. Everything you could see the whole thing.
Well, what I thought was really cool is that areas that had gotten missed or overlooked, didn't show the image. It was just blue there.
Right.
So
and
it
tells
go
the
back.
clinician if they can go back and they need to rescan that area again, or it could post-process it and fill it in, and everything. And that's something that is just, it's been around for a while, but it's just getting better and better, and like I said, and, we're open to, we believe there's a lot of great appliances out there. There's some great acrylic appliances, some great surgical nylon based appliances out there. But again, what we send to the lab helps the lab to make, or helps that lab or that manufacturer of that appliance to make a really great appliance,
Let's talk about the appliance itself. And I want to step through the process, but the appliance itself that you showed the dentist there on site was unlike anything he had ever seen. He'd been very used to the hard plastic retainer looking device, but the device that you had was quite different. Do you want to talk a little bit about that and why?
Yeah, I'm not at liberty to talk about the name of that appliance, because, but here's what I would like to say. We don't target one particular appliance, because here's the reason why. Whenever we come into an office and I partner with an office, I get them to allow me to sign a HIPAA disclosure. And then that allows me, and we tell our doctors when they come into our program with Nexus and DreamSleep, Nexus Dental Systems, we say, okay, for the next 10 therapies, oral appliance therapies that you do, I would like for you to console me. In other words, let me see the x-rays, let me see let me see everything. And then I work with that dentist to guide them into the right appliance for that patient. For us to say that one size fits all, it just doesn't. Now can a dentist get maybe 1 or 2 or 3 appliances that are their go-to appliance? Yes. And that's kind of like the kind of appliance that we were looking at that we're putting you in. It's kind of like an appliance that the dentist can probably treat. Probably 75 to 80% is a rough estimate. Probably could be higher of most all their patients. But then we fall into people that have a wider arch, or they've got different things going on with their dentition, a different type of bite. And that's when we really want to step back and look at that. And we say, okay, this would probably be the best, appliance. And that's why those measurements and all the things we took into evaluation with your oral cavity and with everything about you. That's the reason why we chose that appliance, because that is the appliance that I feel, from my experience, would give you the best benefit. Now, we have to look at one other thing. A lot of people say, well, functionality. Okay, that appliance will do the job. Well, they all will do the job, but it's will it do the job with that patient's unique dentition and situation and compatibility. You see, if you won't comply to it and you won't wear it, and it doesn't feel right, it doesn't feel comfortable, and you don't feel confident about it, you won't wear it, and the therapy won't be successful. So that we have to take that into consideration when we talk about appliance selection.
It's interesting because I have two other snore guard devices that are a hard material. They're both from the same manufacturer. Interestingly, one, it's really loose. I've had it for a lot of years. It probably should be discarded at this point, but I sleep comfortably in it. The other one, for some reason, my jaw gets out of joint when I use that device. After I use it 2 or 3 nights, I start to get a little bit of jaw pain, and then I'm like, what's going on, right? So I know the fitment isn't correct, right? It was done, in that sort of, fast and furious mode of, hey, look, you got a problem with snoring. Let's just run a mold and let's get this taken care of. But I think that's what's exciting and different about this, and why I'm so excited next week to go and pick up my appliance, because I'm excited to actually get out and sleep with it and see the difference in comparison to the devices I've used in the past.
And we're excited about you getting that appliance because, you've kind of somewhat documented your journey here, and everything. And that's going to help other people, to feel confident that this is something that, hey, that's something I should take a look at. And if it works for you, it should work for other people. And I just want to throw this out there. I think one of the biggest misled concepts or viewpoints of this when a dentist walks in is there's a lot of people out there, and we're not saying anything bad about anybody, but we're saying that are in the same field of training dentists and helping dentists, and they're saying everybody qualifies for oral appliance. Well, that's not true. Not everybody does. Some people are just not. It's just not a good fit. But the number of people that do qualify are really a large amount of people. I mean, that do. But there's some people that don't, and everything. But we want to make sure that person is compatible. Everything fits right, because then that way they're going to have a great therapy, and they're going to be happy, and they're going to be seeing the results and everything. And then we know what they do. They talk, right? And that's Absolutely. What we want for our dentists. Anybody who's a client with us, we want to come in, help them get this going, and we tell them right off the bat, let's get some successful therapies under your belt. Let's start helping some people. Let's focus not on money. Let's focus on the patient. If we get the patient right, the money comes.
Money will
That's
come.
going to fall in place. But we get people, and if Tom and Susan, if they have successful therapies and they're like, hey, I'm sleeping better. Hey, I'm not snoring. Hey, I feel better. And you know what? All these things, I can see all these things starting to happen better in my life. Then they're going to tell people, and we tell dentists right up front, go ahead, if you can, get a taped reference from them.
Testimonial, yeah, for sure.
Put it on your website and everything, because that's big, to get the ball rolling and stuff.
And listen, it is a very lucrative opportunity for dentists too. Let's be honest, right? This is a medical device. It is not. We all know, how expensive medical devices can be, and it is something that can be covered under insurance with the proper diagnosis. But you got to go through those steps, and that's why the process isn't just. I had a couple after one of the first episodes dropped. I had a couple of former professional athlete friends call and say, "Hey, man, I want to get one of these. How do I get one of them? Can I get one this week?" And I'm like, "It's a process, right? You got to get a diagnosis. You have to talk to the doctor. There's got to be a prescription. There's all those steps, because this isn't just a mouth guard that you're, as a professional football player, your mom boiled some water and dropped the thing in, you put it in your mouth and you were done. It is not that. It is a medical device.
That's unique that you said that, because here's one of the things that I find a lot of times is that when dentists are aiming towards this and they're thinking about doing this, they're thinking about, well, there's too many pieces all over the place and too many parts to it. There are some moving parts to this. Yeah. And I'll be honest with you, in the early days when we first were doing dental sleep medicine, there was a lot of paperwork and a lot of hoops we had to jump through. Well, it's a lot smaller now. It's a lot more streamlined. And that's one of the things that we try to do and we've done and been able to do is we have a simplified process that and I hate to say it, but if you follow the playbook, everything will fall in place. And anytime somebody asked me one time, they said, hey, well, have you ever had a dentist that didn't have success under your teaching and guidance? Yes, we have. And let me tell you the reason why. Because they decided to do the buffet process. And what I mean by that is we present to them a proven system and process. And they were like, well, I like that, but I don't like this. I like it. No, that's when you're lowering your success rate. It's not because we don't think we're the gods of sleep or dental sickness, but we do know this. What we have works, and it works very well for clients all over the United States. We're in just about every state. I mean, I've been to Hawaii, I've been to Alaska, just got back from Pennsylvania. So every other month.
Oh, please don't compare Pennsylvania to Hawaii and Alaska.
No, you can't. You can't compare it. But what I'm saying
no
is,
offense to all my Pennsylvania fans. It's a great place to be from, I like to say.
Yeah, Pennsylvania's a great state, and everything. But what we've found out is that, we're in every state. I'm somewhere every other week in an office training, coaching, lecturing, talking, and motivating and helping people. And every one of them does exactly what we ask them to do, they are successful and everything. And you talked about athletes. I know you've had the opportunity to meet some professional athletes. We at Nexus Dental System and with the Dream Sleep program, we have had the opportunity to help a lot of retired football players, NBA, a lot, and to work with these and see them get help. And then they tell other athletes that's just a wonderful experience, and everything.
It really is. Let's talk a little bit. I want to walk through both aspects of the process, both from the patient and then from the provider, because the audience really for this episode is that dentist. And I've talked a lot about my experience as a patient, but let's talk a little bit about both. So, when we're talking about the experience of a provider, it really, and I love even your little note card that you have, let's talk about that, how that conversation comes up in the dental chair, because it was interesting to see you saw something that they did and you were like, we have something that's a little different than that. Let me show it to you. And she was like, oh, that's clever, right? Because instead of it being a difficult conversation, it just becomes part of the dental appointment of asking a few questions that creates a potential opportunity for that dentist to schedule a sleep study. Do you want to talk a little bit about that?
Yeah, if I correctly understand what you're asking, I hope I do. But here's what I would say to that. There's a lot of different takes on screening, and screening, how we begin to bring the patient into this and how we talk to them and present it is very, very important. And I believe it's been presented wrong, or it's been like we're either moving too slow or we're moving too fast when we're introducing and trying to screen the patient and discover if they have an issue here that we can help them with. But the biggest thing about this is that we have a unique screening process that takes it through different levels. And through that level, it allows the patient to think about, because they've never been approached with this in the dentist's office before. They're asking me questions and I'm seeing things and stuff and imagery never seen before. So if that process is approached step by step, slowly and methodical, it really does help the patient to be more compliant and see that they have an issue. It's just like anybody. If you don't think that you have a need, then you don't want to hear about the solution. So what we're doing is we're helping them to see there's a need that they have in their life, and that it could have vast effect in a negative way about comorbidities. That dental sleep medicine can have these comorbidities could develop in your life very slowly, but a lot of times very quickly as we age, and then it could shorten our life. So we look at life. We're living longer nowadays, and people want that quality of life. Well, what kind of quality of life do you want to have later? Do you want to have these comorbidities and all these other health issues like heart disease, diabetes? It could even cause Alzheimer's, dementia. No, we don't want that. We want that quality of life as we're getting older, and we don't want to see these other things develop. And the thing that blows my mind, and I know I've given a little bit about my testimony in the past about how I got into this, but the thing that blew my mind was that within a matter of 3 months, the amount of weight that I lost and how I was able to get off the high blood pressure medicine and get off the, you're no longer pre-diabetic, Stan. And I was like, and my health came back to me. And I thought it was because I didn't exercise enough, which I did need to exercise.
Sure.
I thought it was like, hey, because I'm not eating right. And yes, I did need to eat better, but it was systemic. It was because why? Where the brain was not shutting down, the body was not able to rest, and that causes all these other stress factors on the organs and the whole mental and everything.
I love that. I one of the clever thing that I saw when I was in the office is I noticed that they pass Post-it notes around to the dentist, and where the person is in there doing the cleaning and they're making little notes on a little notepad, and then they pass that to the dentist, and they're like, "Hey, here's this person is ready to see you, and here's what I'm seeing." And I love that you interjected in there and said, that's the right conversation, because that dental hygienist conversation is a 15, 20 minute, 30 minute process. And there's time to be filled, right? I mean, there's always this awkwardness where my mouth is like, I can only go, or right? But what I thought was really interesting there is the way you were explaining of, hey, interject that into the conversation. Hey, how do you sleep? Do you have any issues with snoring? There's some new devices that are coming out in the dental side of things, and just marking that down so that when the dentist walks in and says, hey, I hear you're somebody that suffers with snoring. Have you ever had a sleep test done? No, I never had. Do you ever think maybe you had? Oh, no, I'm not a big fat guy. Well, wait a second. It's not just big fat guys, right? It's not just the big burly truck driver linemen, folks that have these kind of challenges. And I think that was really interesting to see how, Nexus can sort of interject into that conversation that then turns into an opportunity. And really from the dentist side, at that point, it's just a matter of working with them to get the sleep study scheduled. And then Nexus takes over at that point, of getting things, getting the device sent out, getting the results back, scheduling with the doctor, doing all of those steps. And then what you've got is somebody that has a diagnosis that you've got to bring in, do the scanning process, do the measurements, do all the things that need to be done, and then await the device. So from a patient perspective, yes, there's a lot of steps, and it's a pain in the ass to have to sleep with that device for 2 nights. And, but it wasn't. Listen, I was in a sleep lab 15 years ago. It wasn't that. I mean, it's literally a little thing sitting on your finger. It was more of a pain in the ass for me because I couldn't wear my snore guard. So my wife wouldn't sleep in the bedroom with me. She was like, you got to do your thing. But I think the process is relatively simple, right?
If we could kind of backtrack a little bit of something you were saying that really kind of sparked my interest is there's a certain amount of nonverbal silent communication that goes on in dentistry between the hygienist and the dentist and the assistant and different people, because we're not broadcasting everybody's business in a dental office. But what we have found is that that's real important, and how that's communicated to the dentist and to each team member. But one of the things that we found out is that the hygienist is pivotal, but they're either putting way too much on the hygienist, or because they're the one that sees the new patient. Most offices, the new patient comes in, they see the hygienist, first. Well, they're either putting way too much on that hygienist, or they're not utilizing the hygienist in the proper way. And stuff. We feel like we have found that perfect mix.
I think you did. Yeah. And even the technician that was there with us was like, that's clever. Like, I like the way that you approach that, because it brings it up in a very casual way that opens up a door without being salesy or anything like that. And then allows the doctor to intervene at that point and say, hey, look, the hygienist happened to mention there was a couple things that you said. Has this ever been a thing that you thought about? Right. It just becomes much more of an open-ended, versus, well, I hear you're here for sleep apnea. No, it's not. It's not that. And I think, it was interesting in my journey with Nexus, not only as a patient, but also talking to dentists, and hearing from folks like Kevin down in Atlanta, who's, hundreds of devices now, that he's put out. And you know, he's like, it really has become an integral part of our practice. And he said, and the crazy thing is, it's where we're getting the referrals from, you know, and I know we've talked about this a couple times on this show, but the big intimidating elephant in the room is the insurance fees, right? Because you're just not used to dealing with medical insurance. And I think that's the other piece that Nexus has really perfected is, look, let us handle it for you. Like, we're experts at it. We've got Pat, we've got people on our team that know what the heck they're doing. Let the experts do what the experts need to do and get you, you know, do that on the back end. And it's funny, even one of the dentists I talked to, he's like, at first I was like, oh, we'll just do this. And he's like, and now I'm like, we would never want to do this. Like, we're going to let them do what they do because the success rate is much higher. It's a totally different game. And on top of that, you know, you're talking about referrals from, you know, doctors and cardiologists being involved and all those kind of things. We're just not used to having that conversation. But they
exactly. And we've had that exposure. We've been fortunate to be in situations where, you know, we have dental practices where the dentists walk up to us and say, hey, you know, I don't want to be holding that handpiece in another 5 years. I don't want to hold that.
Yeah, right.
You know, and I'm looking for an exit plan. I'm looking for another level to get me where I'm working towards retirement, or I just want to, you know, like I remember one time I had a dentist that came to me, and this has been years ago, and everything. When I first got started and was really starting to reach out, because I used to train dental offices on the, you know, I was a dental assistant as a younger man and everything, and a lab tech. And then, you know, I was helping sleep medicine and nap dental practice, but other dentists would come up to me and say, could you come over this Saturday or this Friday and Saturday and train my office? And that's kind of how it all developed for me, you know, and everything. But, you know, that's just kind of how it all snowballed and started happening, you know, and before you know it, you know, I began to see it grow and grow and grow. But this field is people say, have we mastered dental sleep medicine? No, we have not. But I will tell you one thing, we are leaps and bounds about what we know about it, patterns of success in treatment that we did not see back in the earlier years. And now we're beginning to see it evolve as an evolving science and treatment, but we're doing so much more better and so much more people are we helping than we did before in the early days.
Well, Stan, thanks so much for being here and doing this again. And if you're a dentist and you're interested in learning more, check out the links here at the end of the page. And if you're really lucky, you're going to get Stan to come out and train your team because he's a blast, right? And as long as it's not the month of December, because you're pretty busy in December, Stan.
Yeah. I know that. The other day I was, somebody came to me and said, saw you on, what was it, the Inked or something, you know, and everything. And they said that somebody called you. They said they didn't know your name, but they said the guy with the long white hair and the white beard. And then somebody said the Godfather, you know, like that. And I said, what? And they said, yes. So somebody called me the Godfather of sleep. And I went, no, I'm, but you know, I guess it's one of those names that's kind of stuck, but guess what? I don't consider myself the Godfather.
No, right? But
I don't know it all. I don't know it all.
You're the St. Nicholas of sleep, though, right? You know?
Yeah. I know. But you know what? We know what we know. We've learned through experience what we've learned, and that's one of the things that I want to kind of end on this as we're closing out. Yeah. Why is Nexus the one you should go with if you're thinking about? Because why? It's not about we think we know it all. It's because of experience. We bring so much experience to the table and everything, and we help you to where you're trying to figure all that out, and you're trying to, well, how do I do here? It's almost like a turnkey. We come in, we have that solution, and we can help you get this going a lot quicker and a lot more successful, a lot faster.
I love that. Stan, thank you as always for being here, and thank you all for joining us on another edition of Nexus Connects Us. All right. As always, it's a lot of fun to have Stan on the show and get to hear his stories of working out in the field. And I think Stan brings a level of professionalism and optimism and knowledge and wisdom to Nexus that is really where the rubber meets the teeth. You know, I think we're not talking about rubber, but you know what I'm talking about, where the appliance meets the teeth. That's where Stan is. He is there to help organizations learn how to get proper fitment, how to sell this product correctly, how to fit it correctly, and how to get the best night sleep possible. I'm encouraged with the work that Stan is doing and excited about the direction that Nexus is taking. Okay, well, until next time.